Hello, welcome to my channel. Subscribe or like if you like it. Today we will explain the medicine Phenergan. We will talk about its side effects, dosage, uses, contraindications, pregnancy, lactation, interactions, precautions and warnings. What is Phenergan and what is it for? Phenergan is a medicine used for the treatment of rhinitis, conjunctivitis, hives and other allergies. The active ingredient of Phenergan is promethazine. Mechanism of action: Phenergan, H1 receptor antagonist, anti-allergic. Therapeutic indications of Phenergan: symptomatic treatment of allergic manifestations, seasonal or perennial rhinitis, allergic conjunctivitis, angioedema, mild urticaria, nausea, severe and prolonged vomiting of known etiology, prevention and treatment of kinetic dizziness. Posology of Phenergan: oral. Adults, 50 to 150 mg a day, children 2 to 3 years old, 2 to 15 mg, 3 to 8 years old, 15 to 25 mg, 8 to 15 years old, 25 to 50 mg, distributed in several intakes. Contraindications of Phenergan: hypersensitivity to phenothiazines. Children under 2 years old. Children with severe dehydration or acute illness, chickenpox, measles, sinus infection, gastroenteritis, due to risk of dystonia, jaundice, bone marrow depression, history of agranulocytosis with other phenothiazines, risk of urinary retention due to uroprostatic problems and closed-angle glaucoma. Warnings and precautions with Phenergan: in severe liver failure, in severe renal failure, history of seizures or brain damage and family history of sudden infant death syndrome. Epilepsy, monitor. Elders with tendency to orthostatic hypotension and dizziness with sedation, chronic constipation, risk of paralytic ileus, eventual prostatic hypertrophy. Cardiovascular disease. Avoid prolonged exposure to sunlight, activity involving risk in children, bicycles, swings, etc., in children and adolescents with signs suggestive of Ray's syndrome. Should not delay the administration of adrenaline if necessary. Do not use with severe vomiting without establishing causal agent because of risk of masking symptoms of appendicitis, intestinal obstruction, Ray's syndrome. Extreme care in intramuscular administration to avoid extravasation, never intra-arterial, risk of severe arteriospasm and gangrene. Interactions with Phenergan: sedation enhanced by alcohol, not associated. Increased risk of torsade de pointe with sultopride, not associated. Central depression increased by CNS depressants, sedatives, barbiturates, benzodiazepines, clonidine and similar, hypnotics, morphine derivatives, methadone, neuroleptics, anxiolytics. Increased atropine effects with atropine and atropine substances, imipramine antidepressants, anticholinergic antiparkinsonian, atropine antispasmodic, disopyramide, phenothiazine neuroleptics. Reduced absorption by antidiarrheals, antacids, alsalts. Intramuscular: do not mix with other drugs. Pregnancy and Phenergan. Studies conducted during the first trimester of pregnancy with promethazine showed no evidence of malformation or fetal toxicity, although they are limited studies. In newborns subjected to high doses and prolonged periods of an antihistamine such as promethazine during the second and third trimesters of pregnancy, rare cases of digestive signs related to the atropine properties of phenothiazide have been described: abdominal distension, meconium ileus, delayed meconium release, difficulty in starting feedings, tachycardia, neurological problems, etc. Therefore, administration should be avoided as a precaution during the first trimester of pregnancy and should not be prescribed unless necessary and in any case during the third trimester for occasional use. If administration has taken place at the end of the pregnancy, it seems justified to observe a period of monitoring of the neurological and digestive functions of the newborn. Lactation and Phenergan. Promethazine passes into breast milk. Its administration should be avoided, taking into account the possibility of sedation or paradoxical excitation of the newborn and the associated risks of sleep apnea. Effects on the driving ability of Phenergan. Phenergan may produce drowsiness, especially at the beginning of treatment, which could affect the ability to drive and/or operate machines. Patients should avoid driving dangerous machinery, including cars, until they know how to tolerate the medication. Side effects and adverse reactions of Phenergan. Sedation, drowsiness. Phenergan can also be found in topical use, cream. Mechanism of action of Phenergan topic. Antihistamine, antipruritic and local anesthetic. Therapeutic indications of Phenergan topical. Contact dermatitis, solar erythema, burns, pruritus, insect bites, erythema perneum, hemorrhoids, X-ray dermatitis. Posology of Phenergan topical. Cream, 3 to 4 applications per day. Mode of administration of Phenergan topical. Cutaneous use. Does not grease the integuments. Contraindications of Phenergan topical. Wet eczemas and infected dermatosis. Interactions with Phenergan topical. Not described. Side effects and adverse reactions to Phenergan cream. Risk of skin sensitization.